Welcome back to another episode of The Consult. I'm your host, Lauren Powers, and with me in the studio today, we have my friend and top dentist in North Jersey, implantologist. He wears cool clothes, cool glasses, all that stuff. Dr. Adam Kimowitz, how are you, brother?
I am blushing.
You weren't ready for that, were you?
No, I wasn't. Cool clothes.
Yeah, you look good. How you feeling?
My mom tells me I look good. I don't always feel that way.
Well, let me be somebody else. Like I wish my
Appreciate
dentist, look this cool. So we're happy to have you on the show today.
Happy to be here.
And one of the things that I've always appreciated about you in dentistry is that your heart-centered approach to dentistry. Yeah. But sometimes it's very, very hard to find, which is why people are afraid of the dentist or, whatever their reasons are. And I feel like you kind of cracked the code to the human side of dentistry.
Yeah.
So tell us about it.
So I actually have a picture in my surgical suite that says, it's not a picture, it's a little placard that says dentists are people too. So a lot of patients come and ask us to accomplish a lot for them. And I tell people, I said, I'm not GOD, I'm just DMD. So, but the truth is that we bleed like everyone else. We cry just like everyone else. And I put myself in patients' mindset. When they come in, they think we're going to judge them. We're not. We want to help them. And they come and they cry and they say, I don't smile. My grandkids don't want to hug me because they don't like this or whatever. They're hurting. People are in pain. The public is in pain. I don't mean just physical pain. And I feel just humbled with the honor and opportunity to be able to help these folks. I take it so seriously because these are human beings. Just as much as if I were under the care of anyone else, I would want them to treat me with dignity, with respect, with kindness, with no stigma and no judgment, to not only take the human side of things, but apply those technical skills as well. So the marriage of technical proficiency, clinical proficiency, being able to understand diagnostically that teeth and the mouth are not just existing in a vacuum, they're connected to human beings with a brain, with a body.
With I was going to say, and a body.
Right? And emotions, and be able to marry, we need to keep you safe. We need to help you. We need to get you to that finish line. And we're also going to do it with care, right? I hear so many people say, my doctor has the worst bedside manner. I've never wanted to be that guy. I've always wanted to be Adam, who has a skill set that can help people. And I think that's a gift. Yeah. It's a gift to be able to connect with people and truly be able to make a difference in their lives.
Absolutely. And you do have a gift and you do have a skill set. That skill set is giving the transformations to the patient. I've seen the before and afters. Yeah. Adam, you put in some serious work and are changing lives. Talk to us about the implant dentistry side of your practice. Because we know Denville implant and cosmetic dentistry, we've got the two sides.
Yes.
But I know the implant side tends to be where you like to play, right?
It's my passion.
Yeah, tell us about that.
It's not only my passion, it's my hobby, it's my love. So I just geek out. What I do in my spare time, besides spending time with my family, my parents, my wife, my children, I love what I do. It is such an honor to be able to help people. And there are always new evolving ways with better technology, better diagnostic techniques, treatment modalities, better ways to connect with the public, to really understand what concerns they have and then manifest those into a physical outcome, right? So that part of my practice has been really life-changing for my patients and for me. Absolutely. Because at the end of the day, and I know it's a cliche phrase, I have to be able to live with myself and be honest with people. I have to be able to deliver care. So even when things don't work out well, or if there are complications, I need to get people to the finish line. I need to be able to explain to people these things could happen because we're dealing with humans. We're not dealing with carpentry, nails and screws. And, we are dealing with screws, but biologic screws.
Biologic screws. The good screws.
So at the end of the day, it's one of those things that it's a huge responsibility, but I wouldn't change it for the world because I feel so gifted and blessed to have the opportunity to be able to help people, and it is truly life-changing. And not just for me, but my staff, right? They care so much. It is like takes a village, right? You can't do anything by yourself.
The entire team.
You are defined by the people you surround yourselves by, and we have an awesome group of people that really understands the need of our patients and their fears and what we need to do, not only when successful treatment is rendered, but how to keep them successful 5 years, 10 years, 15 years down the line, giving them those tools. And I just love what I do. It started from my dad, and I get to work with my brother, who is my best friend in the world.
Yeah.
He manages the business side of our practice, and it's great. So not only the geeky side of me working in the practice, I'm also involved in education. I teach other doctors how to do this.
Yeah, so you mentor in several different groups and organizations on how to do implant dentistry, all on X.
Yes.
Tell us about on the permanent tooth replacement side, on the all on X side. What's your approach for full arch?
So I deliver a solution, which is, I guess, the generic for that solution is all on X, but what I do is something called Hybridge. Hybridge is a lab, but it's also a training. It's also a training group. There's also an ecosystem where they offer doctors not just here's how you do it technically, but what are the success factors in putting together a full arch practice.
Sure.
So I'm one of their trainers. I also teach with someone, a group called Implant Pathway with Justin Moody. I'm involved with the Maxi course with the American Academy of Implant Dentistry. It is one of the greatest things because I don't get up there and flex and say, I'm big implant dentist. I talk about how do you manage when things go wrong? How do you handle those things? Because anybody like on Facebook or TikTok or Instagram can show their best case. It's what we want to project to the public. They don't show you the struggle to get there, the pain, the sometimes when we go home in the fetal position after our worst day possible. But what I like to do is expose the truth. Yeah. And the truth is that what we want to accomplish in life doesn't happen because of just thin air. It comes from hard work. It comes from learning from our mistakes, being humble enough to critically evaluate where we could have done better. After every case I do, even if it was flawless, I'll say, what worked, what didn't, what could I have done better? Yeah. What could I have changed, or what could be done to give a better outcome, even if it's from small, soft tissue or just communication or anything else. It is kind of the dentist's blessing and curse to be able to be self-critical but not let it disable us. So it's really being able to evaluate ourselves for future growth. And that's why I love it. It's so intellectually stimulating. It is sometimes it's sometimes painful because those really long days, I just want to crawl up in the couch and suck my thumb and mommy.
But you love it, and obviously, your practice, you're very well known in the area. So many other doctors and practitioners respect you and the work that you do. Let's talk about the patients that you work with, right? And I love asking doctors, what was the patient or that experience where a patient's transformation changed you? Like, where was the patient at when they met you, and what was their journey?
I'm going to tell you about a few, and I don't want to cry. So this is always, every patient that walks through our doors is a story, right? Every life has meaning. Every story has meaning. And I'm touched by every patient, but I'm touched especially by a few that it begins so impactful. We had a young man, when I say young man, he was in his 40s, who was a disabled adult. Okay. He was picked on his whole life. He would barely leave the house, but he was also a genius in that he could assemble a VW engine. He knew every year of every engine and every part, but there was some disability there. And his parents called us up and asked, can you help our son? He was bullied. He was, and he just wouldn't smile. And he also had some very major issues with his jaw, some deformities there that we had to work with. And this happened, I'd say maybe 4 years ago, right before the pandemic. We started his case. It was probably one of the most clinically complex cases. And we focused on the teeth because he literally had every tooth broken down. And I hate to use this, but he kind of had, if you look at Sloth from Goonies, people would call him that.
Oh, wow.
His jaw was misshapen, teeth were grown out, they were coming through the side. And we focused on getting the smile right first. Because again, this is about the teeth. And then we figured out where the implants would go after. So we were about to deliver his final teeth, and then the pandemic hit. So we're in lockdown, and he was left with implants and provisionals, and we're in lockdown. And I'm worried about my patients and implants. Right. And we're all worried in lockdown, obviously trying to order groceries, but we're also worried about not dying from this terrible disease.
Right.
And the world as we knew it
So
was
scary.
Fundamentally changed, right? So on my first day back, we had his arches to deliver. This is my first day. I'm literally in a hazmat suit.
Wow.
Right?
Yes,
I'm literally in a hazmat
Absolutely.
suit. I'm thinking, right, am I playing Russian roulette? But my duty calls, right? So we delivered his teeth, and his mother was there and his father's there, and they start crying.
Oh.
They start crying, and I start crying.
In the hazmat suit.
My staff starts crying because it comes back. It's so impactful.
Yeah.
And I said to him, what do you think of your teeth? And because he's very kind of linear emotionally.
Sure.
He says to me, it'll be adequate.
Aha! All the tears.
Yeah. So his parents are crying, his sister's crying, we're crying. It's like, oh my gosh. He says to me, but it's
That'll
funny.
do.
I saw him on Wednesday of this week, and I said, so how it's been 3 years, right? Or 3 years or 2.5. How's everything going? He says, my life's been so much better. Since
gave you a little something to work with. Yeah.
So that was just so impactful.
That's why we do it, right?
That's why we do it. And that's why we do it, as much as we all need to feed our families. If we can feed our families and get the feels at the same time,
perfect scenario.
We can get the feels, it's a beautiful fit. I'm one of those people. I'm an emo. I'm terrible poker player. My tail would be there.
We can see in your glasses. You're holding all your cards. So let's talk a little bit about the various solutions. So the great thing about your practice is that literally everything a patient could need is under one roof.
Yes.
It's multi-specialty. It's a judgment-free zone.
Stigma-free dentistry.
Exactly. So no matter where you are, you guys can meet them where they are. So kind of talk to me about the progression of dentures, into possibly something fixed if someone needs that.
Sure.
What is your stance on dentures versus the fixed options?
So a lot of people will say, I don't want dentures, or I do. So something fixed is obviously for patients that doesn't come out. It's the closest thing to resemble what you're born with, teeth.
Sure.
It's still a replacement. It's not exactly teeth, but it's the closest thing. It all boils down to quality of life, right? It all boils down to, with patients, what we can do to get them as close to an ideal state. And that ideal is subjective to them. Some patients are perfectly happy in a denture. Some patients are not. And when I say the ones that are perfectly happy in their denture, is it stable? Does it look good? Can they speak good? And can they function?
Right.
And a lot of patients will say, you know what? I don't know if they will or won't. Or I don't know if I want something fixed. So we'll give people options to migrate into fixed. We'll give people options directly to fixed. Another thing we let patients know is they'll never leave our practice without teeth. We got to preserve that dignity. We got to give them hope. We got to know that if they're going to invest in their time and accept me as their doctor and I accept them as their patient, I got to deliver on that promise. I can't say it will be perfect every step of the way, but I will fight for perfection to get them to that, hit that bullseye for them.
Right. Whether it be a denture or
implants, and talk to them, because sometimes they're, marketing's an interesting thing because everyone's like teeth in a day. Sometimes we can do that.
Right.
But everyone's different, which is why everyone has to call and get evaluated. So people will call up our office and say, how much is an implant? Well, I can tell you how much I pay for them with my manufacturer, but it's really ultimately the time it takes to get them what they want. It's the time to provide them for. So if it's a front tooth, it is far more technically complex than a molar, right? Because when you smile, right, or I smile, there is the aesthetics. There's the way the gum tissue lines up, and does that tooth fit in with the neighbors? Does the color match up, right? Does it function well? With the back, it's really more functional, not as much aesthetics, and is the tissue healthy? So there's sometimes more involved. So it's not just black and white. It's not so linear or very binary. It's very, what solution would be best for what your needs are. So somebody says to me, this has to be perfect. There's a lot involved in terms of gum work, and there's a lot more time involved. Somebody says, Doc, I don't care, I just want to chew. Their treatment plan would be very different from a cost and time standpoint than from someone who has very high aesthetic expectations. So it's a matter for us to meet people where they're at. Absolutely. Getting to know my patients, getting to know what their desires are before we even start treatment, and say, yeah, I can help you with that. Or yes, this is what the path looks like. And then not bullying them into treatment, but saying, I'm giving you the information, you decide. Whatever you decide, we'll still be friends. I don't care. If you're happy, I'm happy. Doesn't matter.
And that's all really what matters is the patient happy.
And healthy. Obviously health first, right?
Yeah, we
but
like
if you're
that
healthy
too.
and happy, you know what? I don't care whether we do a denture. I don't care whether we do hybrid. I don't care what we do as long as we've met those expectations and they've made good decisions.
Yeah. So going back to hybrid,
Yeah.
You and I have talked about hybrid
Yeah.
before and how it has really increased your efficiency
Yes.
and workflow.
Yes.
And that's what you teach and educate other dentists on.
Yes.
So, there's some folks that haven't been to the dentist literally, 20 years and 30
Yes.
years and maybe used to older ways
Yes.
of dentistry.
Yes.
So my understanding is that your workflow is technology. It's no goopy goop. Like talk about like how advanced your surgical process is.
So, like you said, it is all a process,
Yeah.
right? It is all a process. So a patient will call up the office, we do our consult, and they say yes. It all boils down to good diagnosis, right? You don't know, like take, for example, GPS. You got to have a starting point.
Right.
That GPS has got to triangulate on your position, and then you say you're going to drive wherever you're going to drive. It's 2 hours. There's 20 routes of getting there. So one of the things that Highbridge allows us to do is offer the most efficient route to the final destination and dialing that in. So what is it about first? With Highbridge, a lot of doctors will go in and implant dentistry, think it's all about the implants. I want to do surgeries. It's not. Implants are just support of teeth. So if I'm going to be delivering a hybrid solution to a patient, we have to understand what their aesthetic desires are, phonetics, meaning can they speak properly, and function, right?
Yeah.
So it's aesthetics, phonetics, and function, and obviously health. So we spend a lot of time on the front end using AI technology, designing the future smile, saying, does this appeal to you?
And they get to see it, right?
You get to see it. Color, shape, everything else. So from that, once we dial that in from an appearance, we then dial into function. We design all our work on the computer using pre-existing scans of their teeth, using old position of teeth and relative to new. If it's a pre-existing denture, we can change tooth position. If there's a bite issue, we can simulate bites on the computer as well. So from that, we then go decide, we now know where the teeth are going to be. We then decide where those implants are going to go relative to those teeth. This is before we've even touched the patient surgically. So in our practice, we have a lot of ways that we can deliver fixed teeth in the same day.
Sure.
Or if their biology doesn't permit it, we'll have them leave with some other options, right? So at that point, we use technology to deliver efficient outcome, not just after the surgery, but there are a lot of times when practitioners will do the surgery, then they have to spend another 8 to 10 to 20 hours taking impressions and molds and goops. And one of the beautiful things about Highbridge is that it's captured a impression process that is purely digital that goes from literally one visit to completion. So I can complete a lower jaw sometimes in as fast as 2 weeks to final. So there are sometimes that when I say not temp,
right, but the final
with
teeth.
the all on X or all on 4, the difference between all on 4 and all on X, and even there's like Chrome and all these, there's great systems and they all work, right? There's, again, a lot of ways to get to a destination, but if you ask me, I want to go direct. I don't want to fly with a lot of layovers. They're not fun, especially in this climate, right?
Another patient probably wants the same too, right?
Yeah, so like I have a patient that will say, you can get this to me in 2 weeks? Yeah, we can. We can get you to completion in 2 weeks. And that's unbelievable. And it's a digital capture process that is actually, it's patented. I was a part in developing it.
Wow, okay.
And honored to be a part of it. And it is also one of the most quality prosthesis because in terms of dental nerd talk, it's the most passive prosthesis there is in the market, and that's always a big issue with full arch complications. So
what do you mean by passive?
Passive means that if you're to screw, so here's your all-in-X model, right? And you screw everything down, and you have one screw bind, and that screw gets, you get like a crunchy fit, and it's not really fitting well. Okay. That's going to put pressure on the implant. So what's going to happen is you're either going to get bone loss down line, right? You're going to get fixture fracture down line. You're going to have screw fracture, which leads to complications. And we want to, this is all about, we're a no drama mama kind of, we want to reduce not just treatment drama, we want to reduce long-term dramas. There's nothing more devastating when a patient comes to the door a year later and says, I have a failed implant. So for one of the critical success criteria in full arch success is passivity. So this protocol allows for the most passively fitting prosthesis on the market. So I teach it. I've made a lot of mistakes with it, all fixed.
Yeah,
but and I'm not too proud enough to say that things haven't worked out. But that's how we learn, right?
Yeah.
And it's really it's changed my practice, we've seen it. We used to do it all analog back in the day. Now we're all digital.
Yeah. And the patients probably love it.
And it's more accurate. They love it. And also the nice thing with this is we can make the patient a part of the decision-making process. The subjective. How do I feel when I see what I look at in the mirror? How do I feel? So the objective is, are those implants osseointegrated? Is a prosthesis passive? Is the material, the occlusion, the bite? Okay, that's a subject. It's a very objective criteria from a clinical success standpoint. The subjective is, do I love what I see? Am I happy with what I look in the mirror? Do I have good lip support? Am I speaking properly, or am I slurring my S's? Those are the very subjective, harder, softer things. And again, every patient comes, some are very exacting, and some are just, doc, I love the patients like, doc, you're the expert, figure it out.
Just do it, just whatever.
And then you get a call from a spouse and say, what are you. So emotional support for these patients is very important. So we bring their family members and their support members, whether it's a spouse or a child, bring them aboard for those very subjective elements.
And it's interesting that you brought that up in terms of the different elements of what a patient thinks versus, what your protocol is or what you believe is the better fit.
Yeah.
How have you ever had an experience where a patient comes in and maybe believes that they need all of their teeth taken out or there's no more hope, and you've been able to save the teeth and still provide that outcome?
All the time.
Oh, wow.
I have patients come to me convinced that they need 2 full arch implant solutions, 12 to 11 implants. And I'm like, dude, you just need 1 tooth fixed right here. And I'll tell them, and I'll be perfectly honest with you, just because they think or they've been told by another doctor doesn't mean that they're always have to go by that. There's always different approaches, different perspectives. And for me, you got to be right with the universe. I would look at you or anybody that, are you my sister, you my mother, my cousin, my best friend, and how would I want to be treated? So I don't want to use my knowledge and skill set to take advantage of the public. It's disgusting. And I'm not saying I see it, all the time, but I see it. And I would much rather tell someone, listen, we need to fix one area and I can save everything else, because it's all about prognosis. Yeah, I could fix something, but if it's going to last a year, you're going to get no value. But if I can fix something, make your quality of life better and save you time, aggravation, dollars, then I'm doing right by you. I'm holding up to the ethics that I committed to when I became a dentist, and I'm holding up to the ethics that I committed to as a human being to another human being. And that's huge. And I think that's really what has allowed us to maintain practice success, because we're real people. We're authentic.
You're a real person.
I try to be.
I've been there.
And I can make fun of myself too. I can laugh at myself, but you know what? It's just like that. You got to be real.
So Adam, what advice would you have for patients who are out there? They may see this program, or they're on that journey to finding a dental home and getting on a path to oral hygiene, because it takes time for people to make the call, and you hope that you're on the receiving end and ready. So what advice do you have for people that are looking for solutions?
So don't get wrapped up in the technical aspect of materials and techniques per se, but really focus on the provider. Focus on the office, focus on the home, because in your home, where your socks are, where the food, you want to feel comfortable that the people that you're going to trust are going to be accountable to you. It's not about how much is X, right? So it's how much is an implant. We get that call all the time. It's not about how much. Don't ask how much is the implant, because if you spend X on an implant and you have a bad result, or if you have a doctor that treats you like garbage, or an office that does, then you're going to get no value. You want to be with someone that is going to own what they say. They're going to be accountable to that. That's going to get you to the finish line, to get you to the target, and that you want to find whoever that you're going to work with. You want to make sure there's a fit. There's not always a fit for me and everyone. There's not always a fit for everyone and me. And I always say this. This is about fit. It's not that I am the best doctor. It's that I would be the best doctor for you and you'd be the best patient for me. And that's okay. We can still be friends, but maybe just the way we do things doesn't work. Because some people will come and say, I need the cheapest, or I want this, or it has to be at this time. And or I want the most expensive X, or, there's all different personality types, and we can't be all to everyone. Sometimes it's better that people find a good fit for where they are, and I hope we're fit for a lot of people, but we can't be that for everyone. But I want to be able to get along and realize that we also, with patients, it can be frustrating, right? We have a same team mentality. Like when you win, I win. When I win, you win. And our objectives are a common goal. And
We're
when
on the
we
same
team,
Mm-hmm.
when we have that mindset, you know what? We can weather any storm. We can weather any storm. And when things don't work out, I'm not afraid to say, listen, we didn't have the outcome we expected, but we're going to course correct and get you there. And I also make sure that when we talk to patients prior to treatment, to let them know what they're looking at. And most times they don't happen, but I also, shame on me if I don't share that, right? Mm-hmm. Shame on me.
Mm-hmm.
So
this has been just so, Dr. Adam, you're such a gift.
No, you are.
No, you
no,
we can go,
you
we
are.
can go back
no,
and
you
forth.
are. You are. You're good.
You have, knowing you personally, and
I'm just kidding with you. I'm messing with you.
Just really knowing you personally and seeing the transformations that have come from your practice and your family approach. There's no secret to why you are so well known in Denville and in dentistry in general, from the lives that you've touched and that you've impacted. And I want to say thank you to you for your time today and sharing with the public, this heart-centered dentistry, this dental approach, this heart-centered approach. And I hope for those that are watching, if you are looking for a dentist or for someone to get you on the path to better oral health, think about that connection. Think about the fit that Dr. Adam was talking about. And if you're in North Jersey, give the Denville dentist a call, right? So, Dr. Adam, thank you.
Thank you so much.
Guys, thanks for checking out this episode of The Consult. We'll see you next time.